Good evening. A newborn baby has tested positive for COVID-19 after an outbreak at the neonatal intensive care unit of St. Paul's Hospital. CTV's Penny Daflos is live at St. Paul's in downtown Vancouver. And Penny, first off, how is that baby doing tonight?
Well, Dr. Bonnie Henry is assuring everybody that the child actually has no symptoms of COVID-19. Nonetheless, several people in that unit have tested positive. And even more, we're talking other families, other people who work in the NICU are now in self-isolation, waiting to see if they've also been infected. In one of the province's oldest hospitals, the section of the facility dedicated to the smallest, frailest newborns is shut down with a temporary NICU set up elsewhere.
You know, this is an unfortunate event. Thankfully, nobody is seriously ill right now.
How COVID-19 got into such a sensitive environment is under investigation. A number of families and staff are isolated and closely monitored for symptoms.
Mostly young children, even infants, do very well with this virus, thankfully.
It's exactly what I've been afraid of this whole time.
Alex Turner is pregnant with her third child, a stressful experience during the pandemic, and even more so now.
We were worried that we might have some complications that would take us into the NICU at Women's Hospital. Our goal is to be in the hospital for as little time as possible.
We don't have any official data to report on, but we certainly can say that more and more families are considering the option of home birth.
The 300-plus midwives in the province have become well-versed in PPE usage and say while only low-risk pregnancies should happen at home, overall interest in their services is high right now.
Midwives can support relieving some of the pressures on the healthcare system by keeping patients out of the hospital and out of acute care settings and out of high exposure settings for patients.
Doctors in family practice and emergency rooms have seen worryingly low numbers of patients since the pandemic began, with the fears of catching COVID from a medical setting blamed for much of the reluctance to see a doctor.
It is absolutely safe to go into the hospital for your pregnancy, for your delivery, for the care that you need.
So, Penny, how will they figure out how the virus got into the NICU?
Well, there is an investigation underway right now by Vancouver coastal health officials. They're doing a lot of contact tracing, as you can imagine, to find out exactly how it got in. But in terms of how it could have spread, until now, parents have not had to wear masks within the NICU. And the way Dr. Henry described the space as being quite large and wide open. And while there were not barriers between the bassinets of the newborn infants, she said there was more than 6 feet of space between them. One final note as well, the maternity ward here is still open. So while it's not business as usual, they are still handling deliveries. So pregnant women who were in that situation where they don't have much of a choice, they are free to come here as usual. Mi Chang.